Hello, so I'm now going to show you how to do the CSU, which is a Catheter Specimen of Urine, for your OSCE exam. Again, as with other skills stations, the examiner will tell you if you've already met the patient, introduce yourself and ID them, so no need to do that. But I would start the same as your others, so decontaminating your hands with a hand gel, palm to palm, fingers interlaced, back of the hands, fingernails, thumbs, centre of the palm and wrists. Again, checking the environment is safe and go and discuss the procedure with your patient. So, hello Anne, how are you?
Fine, thank you.
Okay, the doctor's asked me to take a sample of urine from your catheter, is that alright?
Yes.
So it's not really painful procedure, I'll just have a look at the catheter and take it directly from there. Okay?
Yes.
So do you need anything in the meantime?
No, thank you.
No. Okay, so I'll go and get my bits and I'll be back in a minute. Right, so just explain the procedure to the patient briefly and then go and collect your items. If you've touched the patient there, decontaminate your hands. I haven't. So first I need a 10ml syringe, which is clean, intact and expires 2024. I checked that my trolley is visibly clean and it's been cleaned with soap and water in the last 24 hours. Seeing as this is not a sterile procedure, you don't need to clean it before. One Inco pad, which is clean and intact. I need two 2% Sani cloths. It says 2% here to remind you. And they are clean, intact, expires 2024. I need my sampling bottle, which is clean and intact. This one doesn't have an expiry date, but I'm happy to use that. I also need my apron. My alcohol gel and 2 pairs of non-sterile gloves, so 4 gloves. Okay. So going back to your patient's bedside, obviously before you do this procedure you would close the curtains and make sure there's no cleaning or anything like that going on in the bed to make sure your patient has privacy. Okay, we stop. Okay, so now putting on, decontaminating your hands. Again, always make sure you demonstrate all the steps of hand hygiene when you do it with your hand gelling. Put on your apron. And your first pair of gloves. Alright then Anne, I've got everything ready, so I'm just going to have a look at your catheter. I just need to take your covers off, is that alright?
Okay.
Yeah, so just expose your patient so you can see the catheter port. With these catheters, our sampling port is here. This is typical of the catheters we have in the UK, and this is for the balloon, this other port. Place your Inco pad under your patient. Sometimes in the exam this will already be done for you to keep the area nice and clean. And clamp your catheter. So I will clamp my catheter a few centimetres distal to the sampling port. In the exam you'll have some actual urine there you can remove, but for now this is what we have to practice. Okay, now after you've done that you need to change your gloves. So dispose of these gloves in the yellow waste bin. Gel your hands, because we will now start our clean procedure. Okay, wait a few seconds for them to dry and pop on your clean gloves. So my catheter's clamped, everything's fine there. So cleaning your sampling port for 30 seconds and letting it dry for 30 seconds. So what you need to do now is either clean it for 30 seconds or you can start to count 1, 2, 3, 4, 5 and your examiner will say 30 seconds is up. And now let it dry for 30 seconds. So 1, 2, 3, 4, 5, 30 seconds is up. Okay, I would now open my sampling bottle ready. Taking your 10ml syringe and placing the syringe directly in the middle of the port. Aspirate about 10 ml of urine and then transfer them into your sampling pot without touching the edge. Okay. Unclamp your catheter. Now what you need to do is clean the sampling port again to make sure it's nice and clean. Again for 30 seconds and letting it dry for 30 seconds. So 1, 2, 3, 30 seconds is up, and now I've let it dry for 30 seconds. So 1, 2, 3, 30 seconds is up. Remove the Inco pad. Cover your patient up. Okay, so I'm all done with that now, Anne. Is there anything you need?
No, thank you.
Okay, so just give me a ring on the bell if you need anything and I'll be back. Okay. So now in the exam your pot will be pre-labelled, so no need to label it. Dispose of your items in your clinical waste bin. Then removing your apron first and then your gloves. Decontaminating your hands. And I would just inform the examiner now. So examiner, I finished with my station. I would now go and clean my trolley and document in my patient's notes what I've done and send my sample to the lab. And that's all with your CSU station.